So question here, the client with abdominal aortic aneurysm is admitted in preparation for surgical operation. Which following should be reported to the doctor? So a patient admitted because of aneurysm, right? In aneurysm in aortic aorta, abdominal aorta. So aneurysm is danger because if it is ruptured, it is life-threatening condition. When you prepare your patient for any kind of major surgical operation, if you see any abnormalities, we always report it to the doctor. Then we decide everything is okay or not. So number A, elevated white blood cell count. So when any person white blood cell count is go up, it means patient has an infection. When patient has active infection, it is not a good time to go for surgical operation. It is need to inform to the doctor because this patient need antibiotics, control the infection, then go for further management. Number B, abdominal buoy. So if your patient have an abdominal aortic aneurysm, abdominal buoy is supposed to be there. It is expected findings. Nothing abnormal. It is accepted finding because patient is diagnosed abdominal aortic aneurysm. Number C, negative Babinski reflex. It is irrelevant about these questions. People that are equal and reactive to the light, very natural findings, normal findings. So the answer here is A. A is the answer, right? Because this is not normal. So elevated white blood cell count should be reported because this indicates active infection. Abdominal brewing will be hard if the client has an aneurysm. And a negative Babinski reflex is normal in adult. Also, as are pupil that are equal and reactive to the light and accommodation. So nothing abnormal. So answer B, C and D are incorrect. Question here, if the nurse is unable to elicit the deep tendon reflex, unable to elicit the deep tendon reflex of patella, the nurse should ask the client, number one, pull against the plum, grimace the facial muscle, cross the legs at the ankle, and perform Valsalva maneuver. So the correct answer is number A, pull again the plums. So if the nurse cannot elicit the patellar reflex, it is also known as knee jerk. So the client should be asked to pull again the plums. And this, number A, this help the client to reflex the legs and makes it easier to get an objectives regarding. So the answer B, C, and D will not help with this test. So facial muscle, cross the legs, and Valsalva maneuver not helps or related to the deep tendon reflex of patella or knee jerk. Next question here. The physician has ordered atropine sulfate 0.4 milligram intramuscular before surgical operation. The medication is supplied in 0.8 milligram per milliliter. The nurse should admit how many milliliter of the medication. So here we go. Answer A, 0.25 milligram, B, 0.5 milligram, C, 1 milligram, and D, 1.25 milligram. So atropine sulfate, it is the doctor's order, right? The medication supplied means your pharmacy gave you this. So what should be the answer? So keep it note, if the doctor order is 0.4 milligram intramuscular, the drugs is available or supplied by the pharmacy in 0.1 milligram per milliliter. So the nurse should make calculation. Means, the doctor's order divided by how many drugs in hand, multiplied by per milliliter. So answer should be the 0.05 milligram. So to calculate this type of calculation, we could follow this formula. So what are the desired doses? So how many milliliter of medication we need? It is equal to doctor's order. Here, physician has ordered atropine 0.4 milligram divided by medication in hand. So it is 0.4 milligram in hand multiply 1 ml. So 0.4 divided by 0.8 multiply 1. It is 0.5 ml. So this is the answer. So if the doctor ordered 0.4 milligram intramuscular and the drugs is available in 0.8 in 1 ml, the nurse should make the calculation by using this formula. So answer is 0.5 ml. So A, C, and D are incorrect. What next? Next here, the nurse is evaluating client pulmonary artery pressure. The nurse is aware that this test evaluate what, right? So number A, pressure in the left ventricle. Number B, systolic, diastolic, and mean pressure of pulmonary artery. Number C, pressure in pulmonary veins. And also number D, pressure in the right ventricles. So what are the correct answer? Let me read this question one more time. So the nurse is evaluating the client pulmonary artery pressure. The nurse is aware that the test evaluate what? Pulmonary artery pressure. So pressure in the pulmonary arteries, right? So it means the pulmonary artery, it evaluates the systolic, diastolic, and mean pressure in the pulmonary artery, because in question mentioning pulmonary arteries. So the pulmonary artery pressure will measure the pressure during systolic, during diastolic, and the mean pressure in the pulmonary artery. So it will not measure the pressure in left ventricles. The pressure, it will not measure the pressure in pulmonary veins, or it will not measure the pressure in right ventricles. So therefore, answer A, C, and D are incorrect. Next question here. The client is being monitored using a central venous pressure monitoring. So monitor central venous pressure monitor, right? So if the pressure is 2 millimeter of water, 2 millimeter of water, so nurse should do what? So as a healthcare provider, every student must know what is central venous pressure and what are the normal central venous pressure is. What are the normal number, right? So number A, call to the doctor immediately. Number B, slow intravenous infusion. Number C, listen to the lungs for any kind of added sound. Or number D, admin diuretics. So the correct answer is A. So call to the doctor immediately. Because I am RN, I do not allow to slow down intravenous infusion without doctor's orders. I can check the lungs, right? And also I'm not allowed to add any diuretics without doctor's prescription. So what I do, if I see any abnormalities, means central venous pressure not within the normal range, I should call to the doctor immediately. So the normal central venous pressure usually 5 to 10 centimeter of water, 5 to 10. So 2 is not within the normal range. So a reading of 2 centimeter of water is low and should be reported. So answer B, C, and D indicate that the nurse believes that the reading is too high and it is incorrect. So next question here. The nurse identifies ventricular tachycardia on the heart monitor. The nurse should immediately do what? So identifies ventricular tachycardia. This is the keyword, right? The nurse should immediately do what? Number E, admin atropine sulfate. Number B, check the potassium level. Number C, prepare administer antiarrhythmic such as lidocaine. Number D, defibrillate at 360 joules. So while you monitoring the heart, you found in EKG ventricular tachycardia, means the abnormal heartbeat more than normal. Tachycardia and origin is the ventricle. So in that situation, what we'll do? Let me tell you what are the correct answer. So definitely, when we see this condition like this, the correct answer is that prepare admin antiarrhythmic such as lidocaine, because patient has a arrhythmia. When heart rate not normal, not within the normal range, maybe more than upper limit or less than lower limit, both are arrhythmias or dysarrhythmia. We have to prepare for stop the arrhythmia. So the treatment for ventricular tachycardia is lidocaine. So I will be prepared for this. So right. So a precardial harm is sometimes successful in slowing the heart rate, but this should be done only if defibrillator is available. But in this question, nothing talk about the defibrillator is available or not. So in the answer A, atropine sulfate will spread the heart rate further. So my patient has a tachycardia. If I give atropine, it will be bed will be worse. Tachycardia will be speed up. So atropine sulfate will speed the heart rate further. Answer B, checking the potassium is indicated, but is not the priorities. And answer D, defibrillation is used for pulseless ventricular tachycardia. Right? And in this question does not mention patient has pulse less or pulse is counted. So ventricular fibrillation or defibrillation will not do. So also defibrillation should begin at 200 joules, not 360. So let me recap it. As I told you, defibrillation should begin at 200 joules and be increased to 360 joules, not at the beginning 360 joules. So next question here, the doctor is preparing to remove the chest tube from the client's left chest. In preparation for the removal, the nurse should instruct the client to what? Number A, breathing normally, hold his breath and bear down, take a deep breath and sneeze on commands. So the correct answer for this question is B, hold his breath and bear down, right? This is the maneuver. So the client should be asked to perform Valsalva maneuver, hold his breath and bear down. It is called or also known as Valsalva maneuver. So doctor preparing to remove the chest tube from the client left chest. In preparation for removal, the nurse instruct the client for Valsalva maneuver. What is Valsalva maneuver? Hold the breath and bear down. Very important for NCLEX board. So this Valsalva maneuver prevent the change in the pressure until an occlusive dressing can be applied, because the key point is here, chest tube remove, right? So when you chest tube remove, the chance to get in the air inside the lungs. So you have to prepare. So to prevent the change, the pressure until occlusive dress can be applied, we go for hold his breath and bear down. Answer A, C, or D are not recommended, right? And also number D is difficult to perform on commands.